Hello and welcome. Today we're diving into the world of autoimmune diseases, focusing on a rare but serious condition called Goodpasture syndrome. We'll explore what it is, what causes it, how it affects the body, and the available treatments. Goodpasture syndrome, also known as anti-glomerular basement membrane or anti-GBM disease, is an autoimmune disorder. In simple terms, the body's immune system mistakenly attacks its own tissues, specifically the glomerular basement membrane in the kidneys and the alveolar basement membrane in the lungs. The exact cause is often unknown, making it an idiopathic condition. However, genetic predisposition, environmental factors like exposure to certain chemicals or infections such as influenza, and even smoking, can trigger the development of this disease in susceptible individuals. Let's talk pathophysiology. The immune system produces antibodies that target the glomerular basement membrane, or GBM, in the kidneys and the alveolar basement membrane in the lungs. These antibodies trigger an inflammatory response, leading to damage. In the kidneys, this inflammation can cause rapidly progressive glomerulonephritis, a condition characterized by severe kidney damage that can quickly lead to kidney failure. In the lungs, the inflammation damages the alveoli, the tiny air sacs responsible for gas exchange, resulting in pulmonary hemorrhage, or bleeding in the lungs, which can severely impair respiratory function. Goodpasture syndrome is relatively rare. It affects primarily young adults in their 20s and 30s, and older adults in their 60s and 70s. While it can affect anyone, men are slightly more likely to develop the disease than women. There are no specific geographical locations that are particularly affected by Goodpasture syndrome, and it occurs worldwide. The signs and symptoms of Goodpasture syndrome can vary depending on the severity and organ involvement. Kidney-related symptoms may include blood in the urine, also called hematuria, protein in the urine, known as proteinuria, swelling in the legs or ankles, caused by fluid retention, high blood pressure, and fatigue. Lung-related symptoms may include shortness of breath, coughing, sometimes with blood, chest pain, and even respiratory failure in severe cases. Some people may experience more systemic symptoms such as weight loss, fever, and joint pain. Diagnosing Goodpasture syndrome requires a combination of clinical evaluation and diagnostic tests. A thorough medical history and physical examination are crucial. Blood tests are performed to detect the presence of anti-GBM antibodies. A rain test helps detect protein in blood. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is the gold standard for confirming the diagnosis. A chest X-ray or CT scan can help evaluate lung involvement. While Goodpasture syndrome doesn't have subtypes in the traditional sense, it can present with varying degrees of kidney and lung involvement. Some patients may primarily experience kidney disease, while others have more prominent lung disease. Some people have both. The severity of the disease can also vary considerably between individuals. Treatment for Goodpasture syndrome aims to suppress the immune system and remove the harmful antibodies. Plasmapheresis, also known as plasma exchange, is a procedure that removes the antibodies from the blood. Immunosuppressant medications, such as corticosteroids like prednisone and cyclophosphamide, are used to suppress the immune system's attack on the kidneys and lungs. Dialysis may be necessary if kidney failure develops to filter the blood. In severe cases with irreversible organ damage, a kidney transplant may be considered. Supportive care, including oxygen therapy and blood transfusions, may be necessary to manage lung complications. Currently, there's no known way to completely prevent Goodpasture syndrome because the exact cause remains unclear. However, avoiding smoking and minimizing exposure to certain chemicals and environmental toxins might reduce the risk, especially for individuals with genetic predisposition. Early diagnosis and treatment are essential to prevent irreversible organ damage. The prognosis for Goodpasture syndrome depends on the severity of the disease, the extent of organ damage, and how quickly treatment is initiated. Early diagnosis and aggressive treatment can improve outcomes, potentially prevent kidney failure and severe lung damage. However, some individuals may experience chronic kidney disease or require long-term dialysis. Recent research focused on developing more targeted therapies to suppress the immune system and minimize side effects. Clinical trials are ongoing to evaluate new treatment approaches. Also, advancements in kidney transplantation have significantly improved the long-term survival and quality of life for individuals with end-stage renal disease caused by Goodpasture syndrome. Thank you for joining us. Remember, knowledge is power when it comes to understanding and managing health conditions.